Hello everyone. What we will be talking about today is the issue of depression and suicide. Also, we will talk about cuts to mental health funding. To help us understand this issue better, we have Brooke, a psychiatric nurse practitioner, with us to share about what is going on.
Thank you, Olivia, for letting me be here today. Let me first say that just having the opportunity to share with you about the mental health of America is a big step towards lowering the stigma associated with such disorders. Also, discussing the budget issues is critical to get the word out to the general public. We need to get over the uncomfortableness of talking about mental health problems in order to work towards improvement.
Now, Brooke, you work in an outpatient mental health clinic, correct?
Yes. So, I see firsthand every day the impact the economy is having not only on individuals, but also the effect it has on the services and availability of treatment options for patients. Currently, the Centers for Disease Control estimates that nearly 1 in 10 adults reports symptoms of depression, with depression being cited as the primary cause of over 30,000 deaths by suicide each year. This is something that is too big to overlook. In 2007, the National Institute of Mental Health indicated that suicide was the 10th leading cause of death in America. Depression has also been cited as one of the top 5 costly medical conditions, with 2006 direct expenditures exceeding $57.5 billion.
Wow. That is a significant number of individuals who are or will be affected by a mental illness. And the costs are staggering. Rachel, you have had a personal experience with suicide. Can you share about that?
Sure, Olivia. I remember it clearly, 9 years ago this past October. I was in my second year of nursing school. Walking in the door after a long day of class, I saw the answering machine flashing with a message. What I heard was the voice of my best friend's father telling me she had killed herself. At first I thought I misheard. But as the message played on, I knew there was no mistake. I dropped to my knees. Disbelief encompassed me, and I cried. She was only 20 years old.
I can't imagine, Brooke, what that must have been like for you. But it seems that your experience has fueled a passion for helping others today.
Yes, having been personally impacted by suicide, I am very passionate about trying to help others avoid similar fates.
Can you tell us all a bit more about how you feel today's economy might be impacting the American public?
I think many would agree with me, but certainly the economy and high unemployment rate is causing strain for a majority of the public today. In 2009, a survey done by Mental Health America indicated that individuals who are unemployed are 4 times more likely to develop a mental illness than those who are working.
Right, well that makes sense. If someone is not working, it could more stressors, like not being able to pay bills, car repossession, home foreclosure. All those things could cause someone to feel depression.
Unfortunately, with depression, we have an increased risk of suicide. Although suicide is a major problem, it is one that can be preventable if treatment is utilized. There are many evidence-based treatments, such as cognitive behavioral therapy, that have shown to decrease repeat suicide attempts. Also, increased screening within the primary care setting can be helpful to detect those at risk earlier. Often, though, the problem is that many people who are at the highest risk don't seek treatment. Stigma is often a common reason why people don't seek help. Also, lack of health insurance, especially with those unemployed, and lack of access to services keep people from engaging in treatment.
Can you tell us a little more about how people have trouble accessing services?
Sure. According to the National Association of State Mental Health Program Directors, spending for state mental health services has fallen 9% between 2008 and 2010. It was projected to fall another 8% in 2011. With cuts to budgets, many agencies are unable to continue providing services to individuals with mental health illnesses.
What happens to those people? If they can get services or treatment, where do they go?
Well, what happens is that more and more people end up in the emergency department, or even worse, some end up in the jail system. A recent article in the Southern Star, a Chicago Sun-Times publication, discussed that very problem. The article said that over the course of one weekend, 6 individuals with mental illness were forced to remain in a local ER for 2 to 4 days because there were no psychiatric beds to send them to. Two other similar hospitals said that the average wait for their patients was about 47 hours for a psychiatric bed.
That is terrible. I bet you don't see a patient who had a heart attack wait 4 days for a bed or to start treatment. Why is this happening?
Well, the biggest issue is the cuts to mental health funding. State governments are finding themselves in a budget crisis and have to make cuts. Unfortunately, those cuts seem to be aimed at the mentally ill. Since we are here in Chicago, let's take a further look at the Illinois crisis. Currently, the governor has discussed plans to shut down 9 health facilities across the state if budget deficits can't be fixed. Illinois is the 5th worst state when it comes to funding provided for mental health services and has slashed more than 30% since 2009.
What can we do to help?
The best thing to do is call or write your local congressman. Make a voice. Support your local mental health groups like NAMI. We have to make noise, not just stand by and let nothing happen. Not addressing the issue will only make access to mental health care and services more scarce and potentially increase the amount of preventable deaths by suicide because of lack of available care. It most certainly will also fill our emergency rooms and jails with individuals suffering from mental illness. These are not appropriate venues for care and will only strain the system in other ways, whether on a state or national level. What really needs to happen is work towards increasing the funding for mental health services. It has been shown that the more mental health professionals per capita in a state, the suicide rate was lower overall.
Certainly, we can all see that this is a very important issue. Thank you, Brooke, for speaking to us today about these issues. I think we all have gained a new perspective, and I will urge you all to get involved or contact your local representative to share your voice. Have a great day, everyone. See you all back here again tomorrow.